Hello and welcome to Prioritizing Healthcare in the 2025 federal election. I'm speaking to you from Toronto, which is located at the traditional territory of several nations, including the Mississauga of the Credits, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. It's covered by Treaty 13 with the Mississaugas of the Credit. We thank them for sharing these lands with us. So good day from wherever you're joining us. My name is Louise Binder, and I'm the health policy consultant for a national organization, Save Your Skin Foundation, that is dedicated to the fight against non-melanoma skin cancers, melanoma, and ocular melanoma through education, advocacy, and awareness initiatives across Canada. Save Your Skin provides a community of oncology patient and caregiver support throughout the entire continuum of care, from prevention and diagnosis to survivorship. My role as the health policy consultant is to analyze systemic health policy activities of engaged healthcare partners, including government, industry, medical workers, and provide to them provide input to them as decision makers and also to the patient community regarding healthcare systemic issues and treatment access issues. And I'm now working primarily in oncology. My background is studies in English and law, and I've been doing healthcare work for patients since 1996. So it's my pleasure also to introduce one of our colleagues, Wayne Critchely, a very long time colleague in the healthcare field and a senior associate health and life sciences at Global Public Affairs. And over to Gail. Gail, you're on mute.
Yeah, number one mistake. Sorry about that, folks. Now I've done it, nobody else can do it, okay? So, Gail Attara, I'm the Chief Executive Officer of the Gastrointestinal Society, and I work also with the Canadian Society of Intestinal Research, which was founded in 1976. So I've been, as long as Louise has doing this, so since 1996, I have also been working in these organizations. So bottom line is we cover everything from gum to bum that can go wrong. And so that's very straightforward, badgut.org. That's all I'm going to say right now, but you can find out everything about us on our website. So I'm just going to give a bit of a background as to what we were doing. Is we got together, Louise and I and our teams, Save Your Skin Foundation and Gastrointestinal Society, and we commissioned Nanos Research. We got together a few months ago and said, something's up, there's this election coming up, this funny thing that we have to do, and we wanted to know what Canadians thought about healthcare. Healthcare is such a key issue to us, but as you noticed 3 months ago, we were talking about other stuff. And as tariffs became the priority for everyone, no one was talking about healthcare anymore. And so we decided that we really needed to get a snapshot of what was going on. So with Nick Nanos's help, we did manage to get a random survey, and he's turned it around really quickly, March 29th to April 1st. And he did come up with 1,000 Canadians from across the country. And it's a pretty good margin of error, was only plus or minus 3 percentage points, 19 times out of 20. And it's part of what he calls his omnibus survey. So I'm going to talk to you. We did 6 questions altogether. I'm going to talk about the first 3 and the responses, and then Louise is going to carry on and do the next 3. So the first one was, do you support well, every question we asked, do you support, somewhat oppose, or oppose the following? So that's the standard answers that we were looking for. And this one was about allowing doctors to deliver healthcare across Canada. And this got an interesting response. So as you can see, 81% really support, and then 14% somewhat support. But what was really interesting is the breakdown in the jurisdictions. You see, Quebec wasn't quite so interested in sharing their doctors or sharing the rest of Canada's doctors. So that was an interesting result. But for the most part, men and women mutually supported it. And when we looked to really who opposed it, the biggest jurisdiction was Quebec, who opposed doctors licensed in one province going to another province. So that was an interesting perspective just to see what was going on in Canada. And I don't know if there's any surprises for those of you watching. Now, the next question we went to is developing a unified electronic health record system. This is very important to the work that Louise and I do in our jobs. And so we wanted to know, having the federal government develop a single unified electronic health record system that both patients and healthcare providers across Canada can access. So the results for this were interesting as well. So about 82% altogether were supportive of that. But 7% opposed. And I always like to look at why people oppose things, but we didn't really get to understand why. But again, if you look in the results here, the biggest opposition did come from Quebec, and the biggest opposition was from men. So that's kind of an interesting thing. You can process this with your own lens, but we just thought it was an important question to ask. So the third question was about designated funds to provinces for improvement of mental health services. And so, I think mental health touches every one of the things that we work in. No matter what therapeutic area you work in, mental health has this overarching effect. When you're sick, it affects your mental health. And so we wanted to know, having the federal government designate specific funds to the provinces for improvement and expansion of mental health services across Canada, ensuring better affordability and quality of care for those in need. And to us, this was a very important thing. And these questions, as they came out to everybody in the omnibus, were not in any order. They were randomized, as it says. So, okay. So mental health is important to everyone. As you see, about 88% will support it. But still, a 4%, like, who are these people that oppose caring for other people? I don't know who they are, but they are there. And they were men, apparently, in Atlantic Canada, who opposed the most support for mental health. But if you see the statistics across there, that really the Atlantic Canada and Ontario were really leading in support for mental health overall, even though it seems that the men were not as supportive in Atlantic Canada. But these are the questions that I'm covering. We can discuss all these later, and feel free to put all your questions into the chat, and we will deal with those toward the end when we have time for questions. But right now, I'm just going to hand it over to Louise, who can take care of the next 3 questions.
Thanks very much, Gail. So the next question that we asked was about allocating funding to provinces and the territories to help patients, especially those living in rural and remote areas, by covering transportation and accommodation costs for medically necessary treatments. This has become a real area of financial toxicity for patients and for the others who help them pay for their drugs. So the answers to the questions were, in my view, not surprising. 83% of the respondents support the payment of transportation and accommodation for medically necessary treatment, especially those in remote and rural areas. The results were similar across the country and across age groups. Women supported this somewhat more than men at 86.1% versus 77.8% for men. So the conclusion that I draw from this is that we should be advocating with governments to include these costs as part of treatment and diagnostic public reimbursement policy and systems. The second question that I covered was national pharmacare. Close to my heart. The question we asked was expanding the extension of national pharmacare, ensuring that all Canadians have access to publicly funded prescription medications. And the results were also not really surprising. We had, but just to put this in context for any of you who don't know, the federal government pays for doctors and hospitals, but not for drug coverage. And so this has left the provinces and the territories to set up their own public reimbursement programs, which has led to what is often called a patchwork of public drug plans across Canada. So recently, the federal government, with strong support from the NDP, tabled the Pharmacare Act. It provides first dollar coverage for contraceptives and diabetes drugs and devices. The process for implementing this is through an agreement with the provinces where the funding is transferred to the provinces for this purpose. And slowly, we're seeing each of the provinces coming on board. We often hear pharmacare also referred to as universal drug coverage. The result of the poll showed a strong support for ensuring that all Canadians have access to publicly funded prescription medications. There were no significant differences between age groups or across the country. The women supported it a little more strongly than men at 84.6% versus 74.7% for men. So I think that people will therefore be expecting the new government to continue this program and potentially to expand it. And so for our last question, another very controversial and interesting one. And it's the question of whether we should be receiving healthcare services from a private provider, such as a family doctor, or at a private clinic, provided the costs are covered by public dollars. And the results of this survey were, to me, a bit surprising. So if we take a look at them, you'll see that notwithstanding the shortage of healthcare workers, including doctors, across Canada, a fairly sizable number of people do not want to solve this problem by having doctors working in private clinics being paid through the public system. Ontario was the least supportive at 55% in favor of doing so. The younger age group of 18 to 34 years of age were the most in favor of this solution. I would say that it's undoubtedly true that we're going to be continuing the ongoing discussion in Canada of national pharmacare long after this election. And so with that, I'm going to turn this over to Wayne Critchely, who's going to talk about where the parties stand on these issues.
That's
Great.
not
Thank you
actually the
very
order we
much.
agreed on. I think I'm next.
Oh, sorry. Okay. Go
Yeah,
ahead, Gail.
sorry, Louise. It's okay. So we were going to go over the key findings of these first, and then we're going to get on to Wayne. Sorry, Wayne, you have to wait, and everybody has to wait for Wayne. But he this way you can update your most recent notes from the latest platform that was released this morning, right? Okay, so overall, a strong majority of Canadians we found supported allowing licensed doctors to deliver healthcare across Canada. And as we know, we are living in a world where it's very really heavy shortage, not just for doctors, but for nurses as well. And accessing healthcare is really still challenging. And we also found that most Canadians support or somewhat support developing the unified electronic health record system. We think this I think personally that it's a very important part of healthcare that we can unify it. We can travel across the country much better. All of these things keep us as Canadians more able to be mobile within the country and do it. We can move from one province to the other flawlessly if these systems are in place. And we also found that the majority of Canadians support or somewhat support the federal government designating specific funds for the improvement of mental health services. And again, this is something extremely important. If for those who have GI conditions, it's definitely a key consideration and very important for us. So it was nice to see that these things are being supported. However, they're not really demonstrated very much in terms of what's being talked about for the election. And then we've also found that more Canadians say they support than oppose allocating the funds to provinces and territories. For patients in remote areas, we find that this is something very difficult for those who live, and Canada being so vast, many people are living in remote areas in the north and even between major cities along the Trans-Canada Highway. There are very big gaps in who can access stuff. And if you need a treatment in a hospital and you have to take, if you don't have transportation, you have to get to there. It's really challenging, and this needs to be covered under our healthcare system. And that most Canadians support or somewhat support expanding the extension of national pharmacare, which Louise spoke to, and that more Canadians say they support than oppose receiving healthcare services from a private provider that's covered by public dollars. And I think of all the things we talked about, I think this is probably the most controversial thing, whether we want that mix of private and public and how everybody feels about that. So after those key findings, then Wayne can tell us now all the things that are going on right now in real time. So there's Breen, you know who he
Thanks.
is, and there's your
Thank,
slide.
okay, thanks very much, Gail. Yeah, before I speak to this slide about the party positions, just a few general comments. First of all, health is not a big issue in this election campaign. Unlike some previous elections where healthcare was much more significant, this time round, it's not a huge issue. It's been overtaken by some of those bigger issues that we know all about, that we hear about all the time. And I say bigger in terms of public interest and concern at the moment. Health was not even a topic in the leaders' debates last week. And it's not an area where the parties have focused a lot of attention. And there are obviously several reasons for that. I mentioned just the fact that health is now competing with a number of other major issues for public attention. There's also, I think, and if you'll excuse just more of some personal observations here, it reflects the ongoing challenge that I think we have in trying to figure out, well, who's responsible for what in healthcare? Because I think we're all aware there are clear distinctions between federal and provincial responsibilities. So we're in a federal election campaign. What are the things that the federal government's responsible for that are appropriate topics for parties to take positions on? Or what are the things that they, at the federal level, want to be involved in and influence that are at the really provincial areas of responsibility? I think, as everyone on this call knows, the administration of healthcare under our Constitution is a provincial responsibility. And but that doesn't mean that we don't have concerns and aspirations and goals from a national level. We do, and that's reflected in your survey. But there are various ways that we can achieve some of those national goals. Typically, we've seen the use of financial carrots and sticks. And you think of Medicare, for example, is very much a case where the federal government contributes funding to support Medicare that recognizes basic standards so that we have common standards across the country. We're seeing a similar kind of approach arising with drugs for rare diseases, although that's proved to be a very complicated program. Other ways that we achieve national goals is through cooperation, through interprovincial agreement on issues. And I think a really good example of that, like it or not, a good example of that is the PCPA, the Pan-Canadian Pharmaceutical Alliance, whereby the various jurisdictions that all operate their own drug plans have got together to negotiate prices for drugs that they reimburse under their public drug plans. So that's a more of a ground up approach, if you will. Some of the questions here and some of the party platforms address the issues related to the shortage of healthcare providers across the country. So yes, that's a national concern because it's a common problem, but you see that individual provinces are staking out programs to do that. In the recent speech from the throne in Ontario just last week, the government promised that everyone will have a family doctor within 4 years. So that's a provincial commitment. So as I say, we've got different ways to tackle some of these issues. And I think that just shows the level of complexity to dealing with healthcare, both federally and provincially, but certainly in the federal election, it shows the complexity of dealing with that and coming up with really good concrete programs as opposed to just pure aspirations. And many of the platforms really are, I think, are aspirational in scope. So another thing that's complicated looking at what the parties are promising in this election is that they have just announced their platforms in the last 3 days. And so it's made it a little more complicated. The Liberal and NDP platforms came out on Saturday, and the Conservative platform came out this morning. So, and the Green platform came out earlier. So I will, Louise and Gail have asked me to comment on what the parties are saying about the questions in the survey that you looked at just a few minutes ago. Unfortunately, because the Conservative platform just came out this morning, I haven't had a chance to look at it, but I didn't have a chance to put input into this slide, but I will do that. We've included the Bloc Québécois in this, but I think there's not really much to say. The Bloc Québécois position on healthcare is pretty straightforward. They think the federal government should stay out of it, that it's a provincial area of responsibility, and that's not uncommon with the Bloc position on most issues. They do propose a significant increase in funding to Quebec, up to 35% of healthcare costs, but otherwise, in their view, the federal government should stay out of healthcare altogether. Other thing I just might mention, because I think this really comes through with almost all of the party platforms, is given the issue of federal provincial responsibilities, that they usually require cooperation and agreement with the other level of government. So many of the pledges are to achieve certain things, but to do so in cooperation with the provinces and territories. And we've seen that with respect to the policy for drugs for rare diseases. We've seen that with Medicare. We've seen that with pharmacare. They require cooperation and agreement. And that's another reason why it often seems to take so long to see progress on some of these health issues. So anyway, I wanted to summarize these platforms of the parties, and at the same time still do them justice. And it's hard to do that in short. So let me just go quickly kind of through this, and I would encourage you, I think, to do two things. One is for specific information on a party platform, go to their website. They're all there, and they're quite detailed. It may take a little while to go scroll through and find what you're looking for, but I would encourage you to do that. The other thing I would encourage you is ask your local candidates. Ask them what the position of the party is. What's their own position? Are they going to fight for something different from what the party is proposing? But all of the parties really are addressing that very first issue about supply of healthcare providers across the country, and with differences in what they're proposing, but basically the same thing. Thousands of new doctors. The Conservative platform this morning went a little bit further. I haven't seen elsewhere, but it could be that I missed it. But they are encouraging the development of a national certification program that would, I think, help address the question of provinces accepting certification of professionals from other provinces. But having said that, I don't think any of the federal parties would oppose any of that. It just requires provincial agreement. And by the way, on that one, we have seen significant movement as a result of the pressures from the tariff issue, significant movement in provincial and federal governments committing to work to try to reduce interprovincial trade barriers. And obviously, the failure to recognize the certification of health professionals from one province to another is certainly, it's a trade barrier, right? So it kind of fits in that. And so it would be great to see some progress being made in that area. On electronic health records, the Liberal platform does promise that they want to ensure that patients have access to their own health data, which I think is probably a pretty widespread desire, I think, on the part of Canadians. And it's a real patchwork, as you know, from province to province, and also in what you can actually get hold of. The federal government has been funding an organization called Canada Health Infoway for some time now, I think a couple of decades probably. And their job is to work again with the provinces who are part of the Health Infoway agency to look at technological solutions to help address the challenges there. So again, the only specific issue on this or commitment I saw on this was the Liberals platform, and it was again, it was in an aspirational form. Mental health this is really important, and I think it's good to see that again the platforms are addressing this issue. The Green Party in particular specifically says that mental health services and funding should be included in Medicare, and there should be an increase in funding. The NDP also supports an increase in funding for mental health. There has been mental health initiatives in health budgets in the past, and the Liberal platform specifically refers again to creating a new youth mental health fund. So this is an area where I think there is a fair bit of support. And again, just for lack of time, I didn't really get in a position to really comment too much on what's in the Conservative platform, except my understanding is that it is certainly would support provinces funding mental health, but leaving it really more to the provinces to decide how and how much they do that. But there is a broad commitment on the Conservative platform that I should not overlook, of maintaining all existing funding agreements that currently exist. So that includes health transfers for Medicare. It includes the current pharmacare program, rare disease program, etc. So their commitment is to maintain everything that is currently ongoing in terms of federal support. Funding remote patients, a very interesting question. I only found references in the NDP platform and in the Green platform to address really the issues of healthcare in remote areas. Maybe not the specific question that you had in your survey, but both of those parties addressed how to improve services in remote areas, and NDP referred to creating public health teams in remote areas, the Greens to more funding overall. So that's an area that you may need to be pursuing with your local candidates. Pharmacare, interesting, very interesting here. The Liberals, of course, have brought in the current approach to pharmacare, which is to cover two categories of drugs subject to agreements with provinces. Their platform from Saturday promises to maintain the first phase. Now, they don't really go beyond the first phase, although I think that language implies that they would be open to expanding it over time. They don't make a specific commitment. Conservatives commit to maintain the existing program. NDP goes much further, of course, and proposes to expand that from the two therapeutic areas to all essential medicines within a year, which is quite a significant commitment. And again, the Green Party supports a full pharmacare program as well. I might just mention a couple of drug-related commitments that the two major parties have made. One that the Liberals have made is to reduce the wait times for life-saving medications. Not quite clear on what that means, but it does sound very much aligned with the initiative from the Council of the Federation, from the provincial premiers, to reduce the time it takes for drugs to be covered under public drug programs from the current levels. So that's something that's, again, commitments. We don't know how that's going to be achieved, but that's a commitment. And so certainly the Liberals are undertaking to support and work with the provinces on that. The Conservative platform today undertakes to speed up drug approval process. And in particular, it mentions a program that would allow for quicker reviews for drugs that have been approved in 2 of 3 other jurisdictions. So again, more details would be required, but that would be, in other words, greater recognition of international approvals by recognized drug approval agencies. Then the question of private providers and public funding, nothing really in the Liberal or Conservative platforms on that, which to me means we're going to leave that with the provinces to handle as they are. So I'm unlikely to see any major changes there. But the NDP and the Greens have much more of, if I may say, a more ideological view of this. They don't like private health care, and they both commit to taking steps to stop or prevent the expansion of private health care. So there's, in a nutshell, I guess, is what I've gathered from the platforms to date. I hope that's helpful. As I say, I would certainly encourage you to pursue questions as you have them directly with your candidates, and also to go online and check out the programs from the platforms from themselves. Back to you, Gail and Louise.
Thank you. I have a few final thoughts. Gail may as well. It seems to me that until recently, there's really been a relatively minor role played by healthcare in the platforms of all the parties, except of course the NDP, which has always been strong supporters of healthcare. And now we see the Liberals coming along towards the end of the campaign, and the Conservatives as well. But even where commitments are being made, they're generally not lacking. They're generally lacking in specific strategies and tactics to actually keep the promise that they're making. The public, on the other hand, has a strong support for pharmacare and healthcare in general on their minds in this election. So there seems to be some disconnect there. And so to Wayne's points, absolutely speak to your candidates. Find out what they're thinking about. We now know most of the party platform, but we don't really know what the individual candidates are saying unless we ask them. And the other thing, of course, is to get out and vote if you haven't already, and to encourage everybody that you know to do the same. So over to Gail for questions. Sorry, you're on mute, Gail.
You'd think I'd learned by now, right? But sorry about that, guys. What can I say? All right, now maybe what we can do is I'm going to stop sharing the screen, and then if you all want to put your cameras on and let's just chat. Let's talk about what things. So right now I don't see a list of questions in the chat, so maybe you can just speak up, put your hand up maybe, and then we can monitor calls that way. What would you like to do?
Maybe I have a couple of questions for
Right.
Wayne to start the bidding. Why do you think that there is such a disconnect between the party platforms on healthcare and the views of the public generally on this? And the other question I'm asking is, why do you think that we've had such an amazing advanced poll turnout in this election?
Yeah, clearly on the latter, Louise, I think there is a fair bit of interest in this election for sure, and just the U.S. issues in particular have really prompted that. Interesting that everyone says that Donald Trump is the issue and the main issue in the campaign, but I haven't figured out any differences in the way that the parties propose to deal with the Donald Trump issue. So it looks like we're voting more on our gut feel about that than any concrete promises or information. But I do think that that's part of it, and I think that the high turnout also reflects the fact that it happened to be convenient to have, over a long weekend for the advanced polls. We'll see what the actual numbers are next week, I guess, and see what difference it makes in the outcome. Did I forget something else that you mentioned, Louise? Mute. You're muted.
Louise is joining
Sorry,
me.
now I'm the one on mute. So we do have a
Oh.
question in the chat. And the question is, have you or do you plan to disseminate the information in this webinar more broadly? And yes, we're recording this, so it will be available for people to see. And how are we going to educate the general public about what the survey says and what the parties are saying at this point?
Well, this certainly was an important issue for us when we talked about this when Justin Trudeau was talking about resigning. And then when he resigned, we were saying, well, what's this going to do to Canada? And then with the influence from, down south, all of these things. And so it matters to us. And I think that we're just so distracted by the other things that are going on around food prices and everything else that healthcare isn't being talked about enough. And so if there's any way that once this gets up, maybe Save Your Skin Foundation can have a link that you can then share it with your peers, or just go out there and have those conversations, because I think it's really important to talk about healthcare now more than ever.
Yeah, we'll definitely put a link up that will give the questions and the responses from the public. And if Wayne doesn't mind, we'll also put up his analysis of where we are, but we'll make with the caveat that things are changing minute to minute on the hustings these days. So yes, we'll do our best in these last few minutes to give people some information that may help those who haven't already voted some food for thought in terms of the party that they'd like to support and the candidate they'd like to support.
And we're also curious whether any of you have other ideas, that things that we should have asked, do you think? What should we have asked? And maybe Wayne might have heard what some of those answers are to the questions that you might be struggling with yourselves. Anybody? Come on. I know so many of you. Put your cameras on. Let's see. Let's have a conversation. Ask questions. No? Oh, look, there's a camera on. Yay. There we go. All right. Come on, we can have conversations here. Like, because this is the time to talk, because then we can then influence the rest. Or I'm not an influencer, nor do I try to be an influencer, but then we can share our information with as many people as we know and want to share that with.
Gail, another way that people can get involved is to actually run for office. And I'm not sure to what extent you're aware of this, but the chair of the Patent and Medicine Prices Review Board resigned his position last month after just 2.5 years in that job because he's running for the Green Party in Vancouver Quadra. I'm not putting in a pitch for him. I'm doing,
no, I know, we know that.
other,
yeah, we found it right away.
But I thought that was very interesting that when you work in the area and you feel committed, that's always a possibility, to get out there.
It's true. Very true. Can be
so, Wayne, do you think there's going to be any surprises in this election?
Personally, I don't think so. I don't think there'd be too many. I don't think we've really seen any so far. It's unfolding as I think people have expected. We'll see. Always interested in any other views on that. Say we'll know everything a week from today. Yeah, I do think in healthcare, one of the things that you're asking, why is it not kind of top of mind? I think I think there is more of an understanding among Canadians now that it's such a complex area, and it's such a complex topic. And the fact that we have different levels of government and so many players involved, it really makes it challenging. So even, if you ask people, do you believe we should have a pharmacare program? You'll get a very high percentage saying yes. But if you tried to get them to pin down what kind of pharmacare program do you want? What would it involve? Who would administer it? Who would pay for it? It becomes much more complicated, and we've seen that these agreements are taking a long time to negotiate. They're only going after two classes of therapy. One of the problems is that we already have systems in place. So how do you build on those and try and, especially if you're trying to make it more universal, how do you build on a whole patchwork quilt of existing programs? And I don't think anyone would suggest you got to get rid of those first, because no one would accept that. So it makes it very challenging. I think people understand it makes it challenging. So
speaking of getting rid of things, Lisa's question here is about Poilievre's statement around there only being two sexes. And so I just curious, Wayne, whether you had any insight into what anything related to healthcare and how that might be affected. And while you're at the same time, I'll give you two questions, because the next one's for Antonella, which is about the social determinants of health with regard to housing. And those are both really, really irrelevant to healthcare. So Wayne, do you have any thoughts on those?
yeah, I think that the parties that tend to approach those in their own ways. One thing that you do notice in the Conservative Party platform is the focus on drugs, drug addiction and drug treatments, which is a very different focus from what you see with the NDP and Green parties. So there's one area where there are differences. But for the most part, when it comes to healthcare, there's a lot of alignment in their at least in their aspirations. Though there would be differences in how to achieve them.
So just to Antonella's second question about housing as a social determinant of health, there has been a lot of talk in this election about housing and the terrible crisis that we find in housing. Did you notice anything surprising in what any of the parties have said about this, Wayne?
No, I think they do reinforce statements that have been made in the past. A lot of it right now, unfortunately, is just the partisan bickering, right? So you didn't build these number of houses or whatever, and I'm not sure that really helps us very much in terms of cutting through. But it is important that I think, again, all parties recognize that housing is an important issue. It's something that needs to be addressed. I'm not sure if there's a consensus yet on how best to go about doing that, but that's a start.
So Derek, I think you have a question.
Yeah, a couple of things. First of all, just on the Liberals, they have committed to $4 billion to build health infrastructure, more hospitals, more clinics, more community facilities for doctors. And so I thought that was relevant to share. On the issue of private healthcare, it comes down to speed. And so if you're given the choice of waiting a year or waiting a month, I think that has an impact on what your answer is, and that wasn't in your question. And so in my own case, I've had a number of skin cancer surgeries. Each time, I'm a transplant recipient, each time Toronto General Hospital has referred me to private healthcare. And why? Because of the speed. If I have to wait and get it done at another hospital, it takes significantly longer. So I think speed, if you're going to reframe the question or change the narrative on private healthcare, I think you have to put the turnaround time to receive the treatment. is a critical factor in how people would respond to that question. Given the choice of waiting a year or 2 or 3 months, and assuming that there's no change in money, it's covered by your provincial health insurance, overwhelmingly, people are going to choose private healthcare. And I think that needs to be taken into consideration around the questioning.
Good points. Yeah. How about another one in the chat? Does someone want to call that out about who do you see as being the holder of knowledge of the education for so Deborah, I don't know if you want to speak to that question. Like you're asking it, but maybe you want to give it a bit more detail, or do you want us to just try to answer what you've put there? Okay.
Hi,
Go for it.
sorry.
That's okay.
Technology. It's a
Yep.
delight. Yeah, so one of my focuses is trying to educate patients. And I mean, that's, difficult enough as it is trying to common speak the healthcare system. But it would be nice to see a central repository of all of this information. What form, I don't know. I'm still mulling all that over. But who would hold this? Who would manage it? Because misinformation is explosive. And who would, I'm trying to figure out the mechanics. How would we do this? Hi, Louise.
Hi, Deborah. It's nice to see you. What about the this? Can you help us a little bit explain what the this is that you'd like to see somehow centralized?
It would be, again, this whole idea of patients explaining to patients, right? Because it's the common language. We know where we're coming from, we know where we're going, and we know how to explain to people. But how do we set that up so that A, it's kept well, and B, it's not mangled or politicized, right? Yeah, I see your eyebrows go up and go, oh yeah.
Well, I'm not going to solve that one.
And that's the head scratcher.
And I don't think any of that is kind of what's on the table related to the election, but I think that you have a good cause to drill down on that with whomever is the government going forward and where you might like to see that. But because so much delivery of it is at the provincial jurisdictions and territorial areas, you might need to do it there. You're going to have to sit down and figure out, like you said, who has this repository of stuff that you want to share. So I think that might be not exactly what we're thinking about for the election that's current.
Valid, very valid. And unfortunately, because that information is also gets tailored across provinces, right? Because of the jurisdictionality and the jurisdictionality of scope of practice. Yeah, I'm stuck.
Yeah.
But you are correct.
But clearly healthcare we got a lot of work to do. Ain't none of us going to be out of jobs anytime soon. We all have work to do in healthcare, that's for sure. So, I see we're getting close on time. We want to keep it to end in 8 minutes, but maybe if there's any other sort of platform type questions, we can put Wayne back in the hot seat again about what he has learned. And what do you think? Anything you want to say maybe, Wayne, and as we get close to the end here?
I noticed the last question from Jamie. Do you want to take that question, Gail?
Yeah, just wondering anything is up in the air now, especially after the debate. So how fast do we need to act afterward on rebuilding relationships with new MPs? And yeah.
I think it's going to be a real scramble. We'll be surprised, I think, in some ridings. Some ridings are going to be like, but I expect some surprises this time. There's just too much going on, too many moving parts. And even Nick can't get it right all the time either in his predictions of what's going to happen, right? And so I think that as patient group representatives, those of us are here, and I see there's some from pharma here, but I think that we really do need to build those relationships. That's the number one thing going after and finding out, you know, whether we have a new health minister when this is all over with, how it's all going to look, and really building those relationships again. We also have to pay attention to the upcoming Council of the Federation and what's going to go on all those places. I mean, it just, you know, every election, there's more work for us to do, whether it's provincial or federal.
And we have to remember to hold them to their promises. Seems to be what happens every time. They make us a lot of very attractive promises, and then once the election is over, somehow there's a amnesia sets in. So I think we really have to keep at them about what the commitments that they've made in this election.
Yeah, no, that's a good point. Really good point. All right. Any other comments? Did everybody vote? Has everybody already voted? Is this a moot point? I mean, come on. You should have a way of show of hands to see who's already voted and who's just curious about this, and because they've already made their decision and they want everybody to support their decision. Is that happening here too? Anyhow.
Well, I voted.
Okay, voted.
There
All the
you go.
voted. Okay.
I confess, I wasn't going to
I've
be
also
around on
voted.
the 28th.
Yes, I did as well. So, but record advance polls, as Wayne pointed out, so it's really, really interesting. So we're losing everybody, so maybe we should just wrap it.
Thank you so much for joining us. I hope this was helpful to you.